the question is, President Obama's plan, well, he doesn't have a plan, but whatever plan's out there he talks about, he's going to get half the savings for that from the waste in Medicare. Now, that's all smoke and mirrors. He says he won't vote for this if it raises taxes by 10 cents. Another smoke and mirror. It's common sense. And if he can get this much savings out of Medicare, why isn't he doing it right now? Why didn't we do it a year ago, 5 years ago? You've got Social Security broke, you've got Medicare broke, you've got the abysmal care for veterans, rats running around in Walter Reed Hospital before they finally fired a couple of generals. They finally got the message. Now, you mucked up everything you get your hands on. Now, why? Final line is, Mr. Congressman, don't pee on my leg and tell me it's raining.
I wouldn't dignify you by peeing on your leg. It wouldn't be worth wasting the urine. But
I just have one question, which was brought up with Obama's speech, and I would like to know, will proof of citizenship be required to join the new health plan?
the question of proof of citizenship is an issue different. The new health plan will not pay for illegal residents, okay? But there is nothing in the bill that requires proof of citizenship, say, when you go to an emergency room. And I don't think we want that. I mean, I think whether we're citizens or not, I don't know how the hell I'd prove my citizenship if I had a heart attack and they hauled me off. I don't, yeah. So there is nothing in the bill that requires showing a proof of citizenship, but it does suggest that people who are not here legally would be able to participate in the exchanges in other parts of the program or get subsidies. Okay. You know, what you think we should require everybody to have proof of citizenship?
Yes.
You know, if we're not going to have a public option, then I don't think we should have an individual mandate for everybody to have health insurance. Or, you know, I really don't think we should hand over another 40 million people to the insurance companies so they can, you know, get another 30% profit from the taxpayers.
Okay.
Hi, I'm really in favor of the Obama plan, but one question that I do have is in the event that there is no public option, how does it work with the insurance companies that are already so expensive that many of us can't afford the rates right now?
Well, the insurance companies that are there, if they want to sell through the exchange, would first of all have to adjust their benefits and their rules. And then, if there's no public option, it seems to me the alternative would be the federal government have to set the rates, particularly for those people who would be subsidized, and that's most low-income people.
And I'm not here because I got a call from some organizing group or from a union group. I'm here because I'm a concerned citizen. I'm fired up about the government taking over our banking and financing industries. I'm fired up about the government taking over our American car industry. That's really helped Noonie. 4,700 people are going to be losing their job after the first of the year, and tens of thousands of others in the area are going to be losing their job because their goods and services will no longer be necessary. And I'm especially fired up because of the huge, massive spending deficits that we're dealing with. Obama in 8 months has accumulated a deficit almost 3 times larger than what Bush did in 8 months, not 8 years. If I need to buy something, I'm going to save the money first. So let's cut the waste now.
All right. It's too early to tell. I just have my own opinions as to what the best way to do it. You may have yours, and I hope we're both right that we can save some money and get people back to work, because we're in deep trouble, and it ain't going to go away quickly. I don't think. I think I'd like to believe the president say, "Oh, things are getting better every day," but I'm not seeing it around here.
I want to, just make sure that we represent the U.S. Constitution. I believe that the government's role is to make sure that the Constitution is upheld and not to put all these programs together. My husband comes from the automotive industry, has been out of work since December, but we have, scraped our pennies and things together, and we're picking ourselves up. I come from good Midwestern stock. And I've been taught to work hard, and when times are lean, you work harder. And we've been on very, very lean times. But I'm not asking for a handout or a bailout. We work harder. Now, do I agree that reform and things need to happen? Absolutely. Because being, an independent payer of my own health care for my family, the costs are exorbitant. They're outrageous. And it's going up. We just got a $250 a month increase on our private insurance. Let's get down to the root cause of what the problems are. Let's talk about the physicians. Let's talk about all of this extra waste in spending. Let's approach the fraud that's going in through the Medi-Cal, Medicare, Medicaid. Let's talk about those things in depth. Let's not make an immediate decision in 30 days because we have to. So, Mr. Congressman, I ask that you please take, our message back, and let's get to the root cause and what is the plan for addressing that and focusing more on our unemployment than the health care at this point.
Well, I can't disagree with you that unemployment is a vital concern. I'm not sure that we don't have to do them together. It isn't going to do any good for people to go back to work if they can't get medical care, or it's doing less good.
But there was a second email that said that at the very end says, "Let me be clear that the health care is not going to be a government-run health care. You're not going to take over health care." Now, what you said back in April and May basically doesn't say that. So my question to you, Mr. Stark, and I say this respectfully, is, were you lying then, or are you lying now?
You must come from South Carolina. If I said in April or May that a single-payer plan would evolve, I would stand by that. That's likely over the next 20 years. I would say further that I think medical care will evolve over 20 years to end up being more like Kaiser. There'll be more managed care plans, more physicians working on salary, less fee-for-service and independent practitioners, particularly in large areas. So I think, it's my opinion, that no matter what government does, you will find a growth in multidiscipline group practice of physicians, because medicine's getting more complex and they want a better lifestyle. So I am willing to hear from you. I'd like to hear from you in terms of, not let's just scrap the whole idea, but how could we do it better? And that's the underlying purpose of these meetings. I appreciate you being willing to pitch in, whether you think I'm a liar or not. I still want to get your input, and I'll make up how I'm going to lie about it after I get it. But all right, thank you all, and we'll see you next month.